Good morning, colleagues. This is Jeanette Ives Erickson. I'm the chair of the Commission on Magnet. And as you know, I'm calling today on behalf of the Commission, as well as the Magnet program office staff that you have been working with. In particular, our colleagues, Monica Work, who is your senior analyst, and Rebecca Matthews, your Magnet specialist, as well as the appraiser team that you recently welcomed into your organization during your virtual site visit. As you know, the Commission has reviewed all of your submitted documentation and the findings from your recent site visit. As a result of the final review, it's my absolute honor and privilege to bring you some good news, because you need good news, that the Commission on Magnet has unanimously voted to credential Cook Children's Medical Center as a Magnet organization. Congratulations.
Bravo.
So proud.
Yeah, that sounds like the auditorium that's breaking out.
Yes, we've had a little confetti coming down too.
Oh, nice. I'm so glad to lift your spirits, to celebrate the wonderful work that you are doing on behalf of your patients, your families, and of course, as we know, in this incredibly difficult year, what you're doing for each other. I'm certain that some of you want to speak, but before I turn this microphone over to you, I want to take a minute to share some of the observations made by members of the Commission on Magnet while reviewing your organization's documentation, and to delight you further, to tell you that you have 4 exemplars that were identified in the course of the appraisal process. And for me, they're just 4 wonderful exemplars. So let me begin. The first is under the Magnet model component of structural empowerment. And it's related to what I would say is a very impressive residency program that you've had in place. Everybody's shaking their head, yes. You've had this in place for 11 years, earning 3 consecutive accreditations from CCNE, dating back to 2011. You have more than 642 nurse residents at the time of the site visit through, December 2019. The current program, as you well know, averages several hundred applicants and 80 to 90 new residents per year. Your retention rate for the first year as well as year 2 is truly impressive, and it really sets a nice national standard. You really give each of the residents an opportunity to work in various places in your organization. And what I think was pretty unique that was identified during the site visit is that you prepare these nurse residents for national certification. So I think you go one step further than most of the residency programs, and I suspect that that's just something wonderful to not only attract new members to your organization, but a wonderful retention strategy. And I always think certification is a fabulous public message that the nurses that are caring for them meet national standards. So congratulations on that. You also have many people in your organization who have gone through this program that have stepped up into new and different jobs. And I love the fact that 97 members of your residency program are preceptors for other new nurses in your organization. So congratulations on that wonderful exemplar. The next exemplars are under the Magnet model component of exemplary professional practice. So the first one is that during the site visit, the virtual site visit, your staff really talked a lot about the interprofessional collaborative nature of the way in which you care for your patients. And this was really identified as a really cross spectrum of healthcare services in the organization, where the organization, is really part of the value system, has embraced interprofessional collaboration, and several examples were provided to the commission. The first is that nurses partnering throughout this interprofessional team also have a level of partnership with patients and families to improve care, and have worked together collaboratively on your safe discharge program, including scheduling follow-up appointments and ensuring that medication are with the patient and family prior to discharge. The next example is that your nurse-led patient and family advisory council worked hard to improve patient and family education. Nurses in your organization created a group of family volunteers to share experiences and to offer support to other families. So really taking the patient narrative or the family narrative and helping to elevate the practice and helping other family members. And a lot of work that was done in your TCU/RCU was highlighted on the site visit. The next example was the peritoneal dialysis education program for patients and families, consisting of 5 to 7 visits. There's an instructional binder with pictures. Families are sent home with dialysis supplies. There's great nutritional education, and there's a feedback loop for these patients and families. There were multiple examples of disease-specific clinics where services are co-located for patients in facilitating multiple visits and diagnostic testing. You have a school partnership program that for this patient population is so important. And that school partnership helps to manage patients' health and provide education on the disease process for people within your community. The next great example was your palliative care service, not only for inpatients, but also in your ambulatory setting that extend to the family, but also siblings, especially if there's the death of a child. The next example was the nurse-driven creation of the discharge coordinator role that's decreased discharge delays. It was described as having improved collaboration within the interprofessional team, and that it really improved the patient experience. And then the next example is a program that personally is near and dear to my heart, which is your nurse-driven homeless program, serving over 600 children in the area, providing access to primary dental and mental health services with a transportation service. And the creation of a community partnership was well described. So again, thank you for all that you're doing for these children, for their families, and as well as the work you're doing within the team. I thought that was a beautiful exemplar. The next exemplar is, again, exemplary professional practice. And this is that in your ambulatory setting, the nurse-sensitive clinical indicator, peripheral IV infiltration and extravasation, that data outperformed the benchmark statistic for all 8 quarters of data presented. So again, congratulations. And the fourth exemplar is related to patient engagement. Your unit level data for patient engagement or patient-centered care outperformed the vendor's national benchmark statistic and the comparison cohort for the majority of 8 quarters on 100% of your units. So not only are you able to celebrate your 4th designation today, the level, high quality, interprofessional care that patients and families are receiving should be a moment of reflection and a big high five in your organization. So congratulations, colleagues.
Thank you, Dr. Erickson, and to the Magnet Commission. We are so proud of our staff, and I am so proud of the opportunity to share the great work that's happening at Cook Children's and to receive this fourth designation as a magnet facility. So I think that I'm so proud to be able to share that. I'm thankful to my magnet program director, Barbara Peace, who really put our train on the track and kept us moving forward. You know, these are difficult stories sometimes to put together with the evidence, and my congratulations to the entire team here at Cook Children's. So thank you, and thank you for the feedback you shared. Those programs we're so proud of give us some steam to keep that engine moving forward, so thank you. Barbara.
Well, thank you.
Yes, and Dr. Erickson, this is Barbara Peace. Thank you so much. This has been a truly wonderful experience for everybody, and I think it really was what we needed for 2020. You know, 2020 was very difficult in a lot of ways, and to be able to celebrate our nursing staff and really take a step back and see, you know, the why. Why do we do what we do every day? It was incredibly beneficial to the entire organization, and so thank you and your team for recognizing that, and we really appreciate you.
No, we appreciate you. Yeah, we thought 2021 would be better.
It's like the crazy stepsister, yeah.
I woke up this morning and complained that it was snowing here in Boston. I have nothing to complain about.
Yeah, you can have your weather back. That's we're done with it.
Certain of that.
Thank you so much. We really appreciate you.
Well, we appreciate you. Be well, everyone, and take good care of each other.
We will.
Michelle,
Thank you.
Thank you.
Too.
Have a great day.
Thank you.
Congratulations.
Thank you guys all so much for joining us, both in Texas and otherwise. This is truly a team effort. I think, you know, it takes a village. It truly does. And so you guys are the village, and we are so grateful to each and every one of you. So thank you so much.
I'm so proud of our village.
Yes. Yeah, I mean, great work. It was what we hoped and believed would happen, but you need to kind of get that final word from the Magnet Commission. And here we are. So what a way to end this crazy week. And we're really going to take this and drive it upward, right, for 2021. But I'm so pleased that there was recognition for some of these great niche type of programs and projects that we've worked on. And so that is, I think, the green light, right, Nancy, to keep us moving forward. Woo-woo! No, but the recognition, I mean, this wasn't just, hey, we're going to do something that's kind of interesting. I think there's data to support that, and that's what you all did to really help pull that data together and look at the evidence and the outcomes. We don't want to do things just because they're good things to do. We want to demonstrate improvement and safe and quality care. So thank you so very much. We're going to keep moving forward.
Keep the train rolling.
Oh, yeah. And so very excited. And thank you to our executive team and their support. Mr. Merrill, Nancy Cycle, Stan, Jack, Debbie and Orlando, Nick. You know, we could not do this without the collaboration, true collaboration and teamwork. I mean, we embrace listening, we support one another, and that's what Cook Children's is. And so in support of our promise, in support of one another, and every day in our community. And let's continue to do that. These are tough times. Today doesn't end the struggles we're experiencing, both one another and our community. So please support the community. And I'm just going to put a plug in. Go donate some platelets. We need platelets. So let's get out there and take care of one another. So thank you so much. And we will celebrate more in person once we have herd immunity. So I hope that, I'm going to put another plug in. Vaccination is the way to go. So let's get vaccine in arms. Okay.
She's on her soapbox.
I am. Yeah. Tarrant County needs help Saturday and Sunday. Okay. Woo.
Woohoo. Thank you guys. Have a great rest of your day.
Thank you, guys.
Bye, PT.